This is Dr.
In this
Michael
video,
Landry, and we're going to demonstrate how to cement CEREC restoration using Ivoclar's Multilink Automix. I feel that this is really the only tool that you should use to cement a CEREC restoration with. It gets 34 megapascals of bond strength through the tooth. First you go in once you've got your isolation achieved, and in this case we're using foil-sided cotton triangles in conjunction with just regular cotton triangles to achieve our isolation. If you notice, you place that against the tongue, it will almost bond in place right against the tongue. You take the AB mixture of the Multilink liquid and paint that on the tooth and allow that to stay on there for a minimum of 15 seconds. I usually slowly count to 20 during this time period. At the end of that, you air dry with an air water syringe thoroughly to disperse all of the carrier. Once we've done that, the assistant then hands me the syringe and I inject the cement onto the restoration, which is attached to a little sticky. Then I take that, place it into the mouth, push it down into place. You can see the cement extrude, pop the sticky off, and then use cotton pliers to get the crown seated in the right orientation. Once I've done this, I go back in with small brushes and remove as much excess as possible, trying to get deep into the interproximal areas, removing that from the buccal and from the lingual so that we minimize on our cleanup. Then we're going to flash cure. I use a Dematron LED 2. I'll flash cure for about a second and a half from the buccal and then from the lingual. Holding it in place with my finger so I have proper orientation, on then off. And once you've held it in place once on the flash cure, you don't have to hold it again from the lingual because it's not going to move after that. Then I'm going to go in with dental floss tied with a knot in it to remove any excess. And you'll watch the little piece, you'll see it come out right there, of excess cement. Then I'll come in and do the distal, and if you watch again, you'll see that little triangle, nice soft cement comes out. Then with the Explorer, I'll come back in and remove all the other excess that I can, just scraping it away from the margins. Take away the interproximal as well. Then we're going to go in and do a final cure using the turbo tip rather, of the Dematron LED 2. 5 seconds from the buccal, 5 seconds from the lingual. Since this is an auto-cured mix, it's not necessary to do a full 20-second cure. We're just simply initiating the cure. And this sets very, very hard with just a 5-second mix. Then we're going to go in and just smooth all our cement off of the margins, because you'd like to have a positive margin, positive cement margin, and then you can finish that. In this particular case, I had just a little bit of cement that was actually stuck to the porcelain on the crown. So I'm going to go in just a moment and remove that, checking my lingual margins nice and smooth. Couldn't quite get it to come off with the Explorer, so I'm going to come back in with a handpiece and remove it. Very light touch with a 30 micron pear-shaped diamond is what I'm using right now. We're going to remove all the isolation material, and now we're going to check the occlusion. The only place I'm expecting to get occlusion is on the distal incline of the buccal cusp. And that's right where I got it. You can see a small mark occur. And check that one more time. Have the patient bite and grind a little. And you can see right on the distal, marginal root, distal cusp arm, that occlusion. And that's typically what you can see every time with CEREC using the dental database antagonist technique. I'm going back in and using dialight polishing points. I use the blue and then the yellow to polish those areas that I adjusted. Had to do a little bit more on the buccal than normal because of that cement that was stuck right there. But I'd like to polish these and get them nice and smooth. Go back in and just do a little refining of the occlusal surface, make sure it's nice and polished. And just continue to clean up the area. Check the contacts again for floss. Make sure there's no excess and it pops floss nice and tight. And you can see how easy it is to cement a CEREC restoration using Ivoclar's Multilink Automix. Had a little sticky stuck on the top. We've removed that. This is Dr. Michael Landry. Thanks for watching the video. If you'd like to see more, look at my website, www.houstonsmilespa.com.